Hi, very good evening. So this is our second live session for today. So now we're going to discuss few multiple choice questions from pharmacology as well as general medicine, right? So I'll have question and answer format. So we'll proceed as we have been doing in the past few weeks, right? So we have around around 15 to 16 questions, right? So we'll proceed accordingly, right? So once again, a very good evening. So hope you all attended to the previous live session on electrical pulp testing. So this live session will focus on multiple choice questions from pharmacology as well as general medicine, right? And also please let me know if at all there are any network issues, okay? Thank you in advance. Yeah, once again, a very big hello to all of you. Hi Megha, Prithvi, Tanu. Hi Nitu. So I think you're attending our live session after a very long time. Anyways, glad that you're live today. Hi Abhishek. Hi Ashina. Again, hello. Hi Aishwarya. Regina. So what does it mean? Hi Ramesh. Just give me 2 minutes. I'm just making few settings, so we'll be doing it as fast as possible, right? So because the sooner we complete, the greater chance that we can have a live session tomorrow morning, because tomorrow we're having this radiology image based discussion, so I don't want to miss it. So early morning it will be like great, isn't it? So it's already 9:20, so let's not try to extend this beyond 11 p.m. today. Yeah. Yes, Neetu, hello. Hi Rohit. Now it's really perfect. See, all these days I have been using Safari browser, but now I changed my browser. I started using Chrome now, so it's like fantastic. So I think it's the issue with even browser sometimes. So it's not that I'm just learning subject and the way to interact with you, but even I'm learning a lot of technology, a lot of information pertaining to technology like browsers, internet, websites, servers. Hi Pritika. So I'm typing the first question. So as I said, we'll have questions from pharmacology as well as general medicine. So you have the question. Hi Arindam, a very good evening. Okay, here you have the question along with 4 options. When two drugs having similar effects are maintained or administered in combination, and the resulting response is the sum of individual actions of each drug when given alone, then this result is referred to as additive effect, synergistic effect or synergistic response, antagonistic effect, cumulative action. So when two drugs having similar effects are administered in combination, The resulting response is the sum of the individual actions of each drug when given alone. So this result is referred to as additive, synergistic, antagonistic, or cumulative action. So if we have again an unanimous answer, so you say additive effect, okay. Then what about synergistic response? Okay, fine. So let me just give you an illustration. 1 plus 1 is equal to 2, then that is additive effect. If 1 plus 1 is equal to 3, then obviously it is synergistic, right? So this example will clearly understand the difference between additive effect and synergistic effect. Yes, you're right, Ashina. That's the point I'm making now. Yes. Exactly. So 1 plus 1 will be equal to greater than 2, right? So we have this additive effect. So additive effect is nothing but the effect which occurs when additive drugs are administered. The response is not or no greater than the sum of the individual actions of each drug when given alone, which means 1 plus 1 is equal to 2. So there is no enhancement of potential of individual drugs as a result of being used in combination, right? So that is the meaning of additive effect. And then we have something called as synergistic effect. So synergism is where there is greater than the sum of the individual actions. Like as I said, 1 plus 1 is equal to greater than 2. So a synergistic response occurs when the combined action of two drugs having similar pharmacological effects is greater than the sum of the individual actions. So the best example, alcohol when combined with barbiturates, or we have these drugs like narcotics. So these combinations should be avoided as there can be synergistic action, right? So alcohol is synergistic with Valium family of drugs and narcotics as well as barbiturates. Just make a note of this point, okay? So I hope it's clear, right? Yeah, we'll just move on to the next question. Yes, Jana, you're right. Yes, Ramesh, there is enhanced effect. So we'll move on to the next question. Which of the following refers to the efficacy of a drug? Options include So I'll give you options one by one. So which of the following refers to the efficacy of a drug? So we have options. Option A, relative concentrations of two or more drugs that produce the same drug effect. Option B, the ability of a drug to produce desired therapeutic effect regardless of dosage. Option C, the dose of a drug that will kill a patient. Option D, none of the above. So which of the following refers to the efficacy of a drug? Yeah, so Arindam, you say B, Prithvi, Ramesh, Aishwarya, Gaurav. Hi Gaurav. Yes, Pritika, Tanu, Neetu and Ashina. Brohit. So we again have a unanimous answer here. Yeah, so efficacy. Efficacy is nothing but the ability of a drug to produce a desired therapeutic effect irrespective of its doses based on its ability to stimulate the receptors, isn't it? Yes, Megha. So efficacy refers to the number of receptors that must be activated to yield or produce a maximal response, and it has nothing to do with the dosage. A drug with high efficacy needs to stimulate only small percentage of receptors, whereas a drug with lesser efficacy has to activate large number of receptors, isn't it? And we have something called as potency. So potency, if you observe option A, so relative concentrations of two or more drugs that produce the same drug effect. So when you're comparing my performance with others' performance, then we call that as potency. How potent am I compared to the other person? So potency is the relative concentration of two or more drugs that produce the same drug effect. Right, so it's nothing but a relative concentration and it's a comparative analysis. So that is potency. And you know what, as I said, efficacy is nothing but ability to activate the number of receptors. If I say it's a drug is highly efficacy or effective or efficacious, it means that it stimulates only small number of receptors to get the desired action. But potency is something which has which has something to do with the affinity of the drug to the receptor. So the affinity of a drug to a given receptor is determined by the potency, right? So if I say a drug is more potent, it means it is having more affinity for that particular receptor, having maximal therapeutic benefit. I hope it's clear, right? So the difference, see, you have two answers here. The option B, the ability of a drug to produce a desired therapeutic effect, it's nothing but it reflects the efficacy of a drug. Whereas option A, relative concentration of two or more drugs to produce the same drug effect. So that comparative analysis of two drugs, that's nothing but potency. Okay. And a dose of drug that will kill a patient. We have this LD50 and ED50 if you remember. So lethal dose 50 and ED50 effective dose, right? So lethal dose 50 is the number of patients, not the number of patients. These are done on mice, right? So based on the number of mice killed. So we'll discuss ED50 and LD50 including therapeutic index in the coming questions. Okay? Yeah, exactly, Prithvi. Therapeutic index. So we'll move on to the next question. Yeah, let's see how many of you are going to answer this. Which route of drug administration will give the most? I'm not going to read out because you'll be answering it even before I type out the entire option. Look for the options, okay? Before you answer, please look for the options. Which route of drug administration will give the most rapid onset of pharmacological effect? Oral administration, subcutaneous injection, intravenous injection, intramuscular injection. So again we have an unanimous answer, right? Okay, along with that, also answer in order. I mean, if for example in this case intravenous injection is the first choice, right? So what is the second choice? So to which other option would you give the second rank after intravenous injection? Or in other words, among the rest three options, which among the three options has rapid onset of pharmacological effect other than intravenous? So is it oral administration, subcutaneous, or intramuscular? So you say C, okay, intramuscular, okay, right. We also have one question pertaining to these time durations. Okay, Rohit, you even have this grading of all the options. Good, very good. D, C, B, A. Yes, Rohit, impressive. Yeah, that's a decreasing order. Yeah, I can understand. Good. So among the given options, IV has the fastest route possible, followed by IM, followed by subcutaneous route, followed by oral route, right? So we'll discuss the durations later in the next subsequent question. So fourth question. Hi Lakshman, yes, you're right. Yes, Neha. Hi Neha, I think I'm hearing from you for the first time. Right, here you go. So coming to the fourth question. Which term is a compulsive, uncontrollable dependence on a substance, habit or practice to such a degree that cessation causes severe emotional, mental or physiological reactions? Habituation, tolerance, addiction, none of the above. You guys are extremely fast. It's like you're all eagerly waiting for the question in order to give out the answer at light speed. Okay, so we have a unanimous answer, addiction. Okay, then what is the difference between addiction, tolerance and habituation? So as we have discussed, I mean based on the question you will know what addiction is, isn't it? Yes, Tanu and Fun Updates. So addiction is a compulsive, uncontrollable dependence on a substance, habit or even a practice to such a degree that cessation causes emotional, mental or physiological reactions. I do have a lot many addictions. Okay, so that's addiction for you. And habituation. So what is habituation? So habituation is, before habituation, we'll just go through what is tolerance. Tolerance is a phenomena with decreased responsiveness to a drug following repeated or chronic administration. So that's tolerance for you. So tolerance is a phenomenon of decreased responsiveness as a result of repeated administration or chronic administration of a given drug. Whereas habituation is nothing but it's an acquired tolerance from repeated exposure to a particular stimulus. However, there is psychological and emotional dependence on the drug, tobacco or alcohol, which results from the repeated use of a substance, but without addictive physiological need to increase dosage. If at all there is physiological need to increase dosage, or if at all there is addictive potential or emotional dependence, then we call that as addiction. Whereas habituation is nothing but tolerance, which is an acquired tolerance which is obtained from repeated exposure to a particular stimulus, and there is psychological and emotional dependence but not physiological. This is very important, and this differentiates addiction from habituation. In case of habituation, there is only psychological and emotional dependence, whereas in addiction there is psychological, emotional and physiological addiction or dependence on that particular drug. Right? So the examples for addiction, drugs, or can be some kind of activities. Okay, fine. Habituation, the best example is tobacco or alcohol consumption, which we are all familiar with, isn't it? Right. So I hope it's clear. So the answer for this particular question is option C, addiction. Yes, Neha, so glad to hear from you, and welcome to our live session, and welcome to our small family. In fact, our small family is so diverse that we have students from all over the country, and of course students from different countries as well. Yeah. Okay, now let's move on to the next question. Exactly, Neha, you're right. Now we have the fifth question. The average time for the onset of drug effect after subcutaneous administration is options. So the average time for the onset of drug effect after subcutaneous administration is immediate, 5 minutes, 15 minutes, 30 minutes. So select the appropriate answer. So we have already discussed extensively regarding the routes of drug administration day before yesterday, or is it yesterday? So when did we discuss that? I think on Tuesday, right? Yeah, yesterday we had this diabetes mellitus. So I haven't mentioned about the duration of time, so we'll discuss the duration of time now. So the average time for onset of drug effect after subcutaneous administration. So is it 5 minutes or 15 minutes or immediate or 30 minutes? Hi Saurabh, hearing from you for the first time, I think. Yeah, welcome to our live sessions. Hi Sahiti. Yeah, yes Regina, it's on Tuesday. Okay, is it A or is it B or is it C? Yeah, immediate action only occurs in 5 minutes. Immediate action occurs in case of IV administration. Hi Deepesh, you say 5 minutes? Yes, Venkatesh, once you enter the drugs, we connect to antibodies. Sorry, isn't it a range? Of course, we have a range. You just can't pinpoint. But if at all you have a question, how are you going to answer it? You can't question the person who is giving you a question saying that the question is wrong, isn't it? I'm just kidding. So if at all there is a question in this pattern, of course we have a range. We will not have this timer, and after 5 minutes or 10 minutes, it's not like it will enter into the bloodstream. So it's like an average. So consider these options as a mean, okay? Arithmetic mean, Aishwarya. Okay. Yeah, okay. The right answer is, do you want me to tell me the right answer or do you want me to wait for some time? Yeah, oral route, it takes approximately 30 minutes. 30 minutes, approximately, observe it, for onset of drug effect once it is swallowed, and we have this first pass metabolism, liver, intestine, and intramuscular injection. So once deposited into the muscle, it takes approximately 5 minutes. Okay, and then you have inhalation also, it takes, I mean, it's more rapid comparatively. It takes approximately 5 minutes. And then topical, it depends upon the use. Okay, topical, we can't correlate that, so because it's only for local action, isn't it? So patch delivery, so you have this, the transdermal patches which we discussed day before yesterday. So even that takes a time similar to that of subcutaneous injection. So in case of subcutaneous injection, the onset of action of drug is, I mean, it takes place after 15 minutes, approximately in and around 15 minutes. So option C is the right answer. So transdermal patches also take 15 minutes. However, these patches release drug into bloodstream over a period of 12 to 24 hour period. Sublingual has to be much faster. So if you ask me, like sublingual, it has to be between 15 to 30 minutes, but I'm not exactly sure of the value or the average, because it has to be less than that of oral route, right? So less than 30 minutes, and it has to be greater than that of subcutaneous or intramuscular, because it has to be absorbed through the tissues, isn't it? So I speculate that to be in between 15 to 30 minutes. I'm not sure, by the way. Crazy boys, you say it's not 15 minutes, bro. Okay, do you have a reference for that? If you have a reference, please share with us. You're talking about sublingual. Okay, sublingual, I said I'm not sure. I said it's between 15 to 30 minutes. I'm smart enough to give a range rather than just committing to one single answer. I was speculating like it would be between 15 to 30 minutes. If in case you have any information, please do share with us. Neha, you say 5 minutes. Sublingual? Okay, right. So just drop a message. We'll go through the next question in the meantime. Exactly. Okay. 15 minutes, patient will die. Okay. Nitroglycerin. Okay. And crazy boys, by the way, you're Priya, right? Okay, thank you. Thank you for throwing some light. So it's quite logical to say that it is immediate, but definitely not 15 minutes. Okay, okay, Priya. Okay, sublingual 3 to 5 minutes. Right. Thanks for adding up. Okay, we'll go with the next question. 6th, a drug with high lethal dose and a low effective dose, ED50, has Topical kitna? Topical is for topical, right? So all these, it's like they have to enter systemic circulation, and that's the time period which we are discussing. The topical, this question is irrelevant because the action is needed only in the topical area, right? Ashina, what is this NEBDY else WIB? Okay. So the question is, a drug with high lethal dose and a low effective dose has a high therapeutic index and is very dangerous, a high therapeutic index and is therefore relatively safe, low therapeutic index and is therefore very dangerous, low therapeutic index and is therefore relatively safe. So effective dose and lethal dose, as one of you rightly said, we have this therapeutic index. So it's a ratio of LD50 to ED50, right? So effective dose is that a dose at which 50% of the people will respond to that particular drug. So that is effective dose, whereas lethal dose is the dose at which, in theory, 50% of people will die. In theory, but the experiments are done on mice, but not on people. Right, so ED50 is the effective dose at which 50% of people will respond to the drug. LD50 is a lethal dose at which, in theory, 50% of people will die if it is administered like 200 people, right? 50%. So lethal doses are always determined in mice but not in people. And the ratio of lethal dose and effective dose gives us this therapeutic index. So the higher the therapeutic index, which means LD50 is more, which means more dose is needed to produce or to kill 50 people theoretically, which means the drug is relatively safe. You try to correlate in that fashion, right? Whereas low therapeutic index is something where even with a low dose there can be lethal effects. So low therapeutic index suggests that the drug is not that safe to use. So ideally or preferably the therapeutic index has to be high. So coming to the question now, a drug with high LD50 and low ED50 has a therapeutic index which is high, low, safe, dangerous. So we have the right option. So it has, so high LD50 means high therapeutic index. So high therapeutic index means it is therefore relatively safe. So option B is the appropriate answer. Rohit, to the previous question, subcutaneous route, it takes 15 minutes, approximately 15 minutes, right? Intramuscular 5 minutes, sublingual, as Aishwarya said, 3 to 5 minutes, intravenous almost instantaneously, and you have oral route, it takes 30 minutes, right? Ashina, okay, I thought that was a code word. I got it now. So the right answer for this question is option B, high therapeutic index, and therefore it's relatively safe, right? I hope it's clear. You have any contradictions, you can drop a message. We'll discuss, we'll have a discussion. And also we have something called as therapeutic window, which is different from therapeutic index. So therapeutic window is nothing but the therapeutic window describes the range between the lowest therapeutic concentration and the beginning of toxicity. So this range is lowest therapeutic concentration and the beginning of the symptoms of toxicity. So this range is called as therapeutic window. So there are some drugs which have very narrow window and they have to be monitored very carefully when administered to patients. Right, we'll just move on to the next one. You have two statements here. Statement 1. and statement 2. Transdermal also the same. It's mentioned as the same, similar to that of subcutaneous. Okay, we have two statements here. Statement 1, drugs travel through the bloodstream by binding to albumin plasma protein. Statement 2, however, only a small number of drugs travel through the bloodstream by this mechanism. So option statement 1 is true, 2 is false. 1 is false, 2 is true. Both are true, both are false. Okay, so answer accordingly. Yeah, yes, Ashwina, it's similar to that of the patch delivery. Transdermal system is also similar to that of subcutaneous, where it takes approximately about 15 minutes. However, the advantage we have with these transdelivery systems, as we have seen previously, is that there will be steady plasma concentration of drug, which is being pumped up into the system in a consistent manner over a long duration of time, isn't it? So come to this question. So before that, Richa, you say effective dose. So effective dose is nothing but the dose at which 50% of the people would respond to the drug. For example, we have this aspirin, which is given in case of a patient suffering from fever. So if we have assumed that we have 100 patients, and if you give aspirin 500 milligrams, so 50% of the patients, minimum 50% of the patients, if they respond to aspirin, then we consider that as effective dose. If at 400 milligrams, if there is no action, if this effect is not seen in less than 50, see, for example, as I said, in out of 100, if 50 people minimum respond to this 500 milligrams, then that is considered as ED50 for that particular drug. What if I give 350 milligrams? Then only 10 people might be responding, or 15 people might be responding, right? So that dosage is not recommended, right? So the dosage which is recommended is based on ED50, that is, which is effective in 50% of a population, right? So that's the meaning of ED50. I hope I made myself clear. You still have any ambiguity? Do let me know. Whereas LD50 is something where the particular dosage where we see theoretically 50% of the people dying, because we don't do experiments on people, we do on lab rats or animals. So theoretically it's like if 50 people die, right? If that particular dose is given, that is called as LD50. So the ratio of LD50 to ED50 is called as therapeutic index, which gives us the safety of drug, relative safety of drug, right? Whether a drug is safe to give in a particular patient, it's decided by therapeutic index. So to the seventh question, statement 1, drug travels through bloodstream by binding to albumin plasma protein. That's true. Statement 2, however, only a small number of drugs travel through the bloodstream by this mechanism. So what's the right answer? Both are true. First true, second false. Efficiency. Efficiency or efficacy of a drug depends upon its ability to stimulate the receptors to get the desired therapeutic action. So most of the drugs travel through the bloodstream by binding to albumin proteins. It's not few drugs. Most of the drugs do follow this format of transfer or transportation, which is abundant in plasma. Albumin is abundant protein in plasma. In this way, drugs are carried to all tissues and organs. So a drug which is bound to plasma albumin, so we have this bound form and unbound form. So this unbound form enters into the tissues, and thereby we have this therapeutic action, right? So drugs travel through bloodstream by binding to albumin plasma protein is a true statement. The first statement is true. Second statement, it's not the small number of drugs, but majority of the drugs do travel through the bloodstream by this mechanism. So the second statement is false. The first is true. Okay. Yes, Richa, you're welcome. Right, we'll move on to the next question then. Okay, so this answer to sixth question. So what is the sixth question? Okay, one of you just help Neha. I'll in the meantime type out the question, the next question. Yeah, so Neha, it's like sixth question where we have high lethal dose and low effective dose, which means therapeutic index is high, which means the drug is relatively safe. Okay, right, we'll move on to the next question, the eighth one, the symptoms of chronic caffeine consumption. So caffeine, we have this in soft drinks, we have this in coffee, we have this in tea. So the symptoms of chronic caffeine consumption can include all except option A, feelings of anxiety and nervousness, sleep disruption, coughing, irritability, diuresis, palpitations. Rohit, you say mechanism of prolonging drug action also. Yeah, because of the bound form, you're right, Rohit. Because you have this bound form of protein, when the unbound form is utilized by the tissues, this bound form, this delivers the drug and there can be prolonged action. That's right, very much relevant. And thank you for sharing. So all the coffee lovers, all the lovers of soft drinks, all tea lovers should know the answer. If you give wrong answer, it means you're not a real fan of caffeine. And if you observe on Coke or Pepsi, it's clearly labeled that it contains no fruit, presence of caffeine. You'll have that in bold letters. So caffeine has this addiction potential. Do you know that? I don't say addiction, maybe you can say dependent. Maybe it's addiction to some individuals also. And thank nature I'm not addicted to caffeine, by the way. But definitely I do feel good whenever I have some coffee or a cool drink. So you mean to say we don't cough? Okay, we have an unanimous answer. Great. So I assume all of you are great coffee lovers. Pradeep Pandey, you say option E, diuresis. You know what, I have observed that personally. The moment I have some soft drink, I feel like I have to go to washroom. There is increased frequency of urination. There is dehydration because of loss of urine. Right. So caffeineism is a term used for people who are dependent on caffeine and suffer side effects from having too much caffeine, or they take large amounts of caffeine and need to keep drinking caffeine to function properly. So they are dependent even physiologically, isn't it? So it is thought to occur. So caffeineism is thought to occur if you make or if you have an intake of more than 600 to 750 milligrams of caffeine per day, which is equivalent to 10 cups of coffee. Drinking more than 1000 milligrams per day is well into the toxic range. So 10 cups of coffee equal to 600 to 750 milligrams. So that can lead to caffeineism. So caffeineism, the symptoms include all we have discussed now. There can be diuresis, there can be anxiety, nervousness, sleep disruption, irritability, stomach pains, palpitations, arrhythmias, etc. Right? So caffeineism is a term used for people who are dependent upon caffeine. It is thought to occur if you have an intake of above 600 to 750 milligrams of caffeine per day, which is equivalent to around 10 cups of coffee, and drinking more than 1000 milligrams per day. In terms of the caffeine concentration is well into the toxic range. And you know what, caffeine, we feel good whenever we have this caffeine because it's a CNS stimulant, right? So caffeine stimulates CNS unequally, and the cortex being the area which is stimulated more comparatively, and the spinal cord being the least excited. Okay, just make a note of these points for fun, right? So caffeine content of commonly ingested products. So brewed coffee contains 100 to 150 milligrams of caffeine. Instant coffee contains 50 to 100 milligrams of caffeine. Decaffeinated coffee contains 2 to 35 milligrams of caffeine. Tea contains 40 to 110 milligrams of caffeine. And Coca-Cola or cola drinks or soft drinks contain 35 to 60 milligrams of caffeine. Okay? Venkatesh, you say, see exactly what caffeine does not to your with this interactive graphic. I didn't get you, Venkatesh. Okay, so coughing is the appropriate answer for this question, right? So option C. So symptoms of chronic caffeine consumption include all except. So it is coughing. So we'll move on to the next one. So it's regarding writing the prescription. When writing a prescription, QID is the abbreviation for 3 times a day, 2 times a day, every 4 hours, or 4 times a day? Why Deepesh is laughing? Do you want banana, Deepesh? So QID stands for every 4 hours or 4 times a day. Yes, for him. Yeah. So BID stands for twice a day, TID thrice a day, Q12H every 12 hours, Q4H every 4 hours, stat immediately, whereas HS is bedtime, PRN is as needed, AC is before meals, PC is after meals. Do you want me to write down this, or is it fine if I pronounce it? Prithvi, I don't have any intention to sleep in this live session. I'm just having fruit so that I can feel good, both physiologically and also psychologically. Sauce is save our souls as required, as and when required. Okay, I'm writing. BID is twice a day. TID 3 times a day. Q12H. Yes, Lakshman. Q12H is every 12 hours. Q4H every 4 hours. Stat means immediately. HS at bedtime. PRN is as needed. AC is before meals. PC after meals. Okay, so these are some of the short forms which we use for prescription writing. Okay, so the answer for this question, when writing a prescription, QID is the abbreviation for 4 times a day. OD is once a day. Thank you, Priya. Thank you for adding up. Yeah, sauce is also like as needed, right? So PRN is also as needed. Priya, you have any information regarding that? Please do share with us. Sublingual route, it's given as 1 to 2 minutes in some articles. Anyways, it's less than 5 minutes, isn't it? Okay, fine. Yeah. Yes, Swapnil. Thank you. Right, we'll move on to the next one then. So 10th question. The following drugs belong to what pharmaceutical class of agents? So we have options. So the following drugs belong to what pharmaceutical class of agents? Pimecrolimus? Yeah, it's not mimus, I'm sorry. Pimecrolimus, sirolimus, tacrolimus. Limus or limus? Pimecrolimus, sirolimus, tacrolimus. So even drug classification can be asked in this format, right? So they can give you the list of drugs and simply ask you like to which category they belong to. Farhi Najmi, we don't have an option called no idea. Yes, Sahiti. Yes, Shrish. Monoclonal antibodies, okay. So pimecrolimus, sirolimus and tacrolimus, they belong to the category immunosuppressants. So option C, immunosuppressants. Pimecrolimus, it's an immunosuppressive agent used for treating mild to moderate atopic dermatitis, pimecrolimus. Whereas sirolimus is used as prophylaxis. It's an immunosuppressive agent used for prophylaxis of organ resection in patients receiving renal transplants. Whereas tacrolimus is again an immunosuppressive agent which is used for treating moderate to severe atopic dermatitis which cannot be treated by the conventional medication like pimecrolimus or other drugs. So atopic dermatitis non-responsive to conventional therapy is treated by tacrolimus. So all these drugs belong to the category immunosuppressants. Yeah, option C is the appropriate answer. Exactly, Richo. So we'll have another question in a similar format. The following drugs belong to what pharmaceutical class of agents? Adalimumab, infliximab, trastuzumab. So let me just give you a hint. We have ab at the end, suffix ab, ab. Adalimumab, infliximab, trastuzumab. So these drug names are like, it's like we can master our pronunciation by pronouncing these complex words. Adalimumab, infliximab, trastuzumab. So what class of pharmaceutical agents, I mean what classification do they come under? Okay, right. So these are monoclonal antibodies, right? We have ab at the suffix, so that's another easy way to just remember these drugs or to identify these drugs. So adalimumab is used to treat active rheumatoid arthritis. Infliximab, it's used to treat ankylosing spondylitis, rheumatoid arthritis, as well as Crohn's disease. Trastuzumab is used for treating, is used in treatment of patients with metastatic breast cancer. Metastatic disease, okay? We'll move on to the next question, right? We still have 5 more questions. I hope you're doing fine. Is it fine, or do you want me to give you a break or something like that? Of course, Priya. Please do share that shortcut. Since you are a postgraduate in medicine, you should be guiding us well. Yeah, please do share the shortcut. And also, Priya, just can you give me your mail ID so that I can stay in touch? You don't, Regina, you don't want break? Yeah, exactly. Yes, Priya, that's what I've discussed now, right? Yeah. I was actually referring to only AB. AB is like AG is for antigen, AB is for antibody, right? So that's how I remember. So as you said, even this is good, right? So we have MAB, monoclonal antibodies, right? Perfect, Priya. Okay, and by the way, thank you so much for giving your feedback also, Priya. Thank you for your shortcut. Right. And also, if you have any other mnemonics pertaining to how to remember the drugs, we would be glad if you can share those with us. Yeah, right. So we shall proceed then. Oh, sure, Priya. Please do share with us. Definitely. That's why I'm asking you your mail ID. I'll definitely contact you through mail or even WhatsApp. Anything is fine. Yeah, thank you. Thank you so much for extending your support. So we have our 12th question for today. It's like we have this rheumatoid arthritis or some kind of diseases where because of abnormal antigens and all, they can be targeted using these antibodies, right? So monoclonal antibodies, they are used in immunotherapy. They will target specific antigens, and thereby they can be used in cancers, rheumatoid arthritis, etc. Right? Okay, it goes and binds to CD. Okay, Priya will answer in the meantime. I'll just type the question, right? Yeah. Please, Priya, please carry on with the explanation. Okay, I'll just go through the comments of Priya and then we'll proceed, right? So Priya, you say it goes and binds to CD20 receptor on mast cell. Okay, antibody. So that's a B cell. Okay, mast cell and B cell. They go and bind to B cell, which are main key role in pathogenesis of autoimmune diseases like rheumatoid arthritis and many more. Okay. Yes, they are for autoimmune. Immunotherapy, they are used as a components of immunotherapy, these monoclonal antibodies. Yes, thank you. Thanks, Priya. Thanks a lot. So we'll just proceed with the next question. 12th one. Priya, by the way, I asked you my mail ID. You can drop your mail ID or you can just drop your mail at proudtobedentist@gmail.com. That would be of great help, right? Yeah, 12th one. Empathic understanding. Empathy, right? Empathic understanding reflects which of the following characteristics? You might be wondering why I'm asking you this question, but see, so far we've done pharma. So now we're going through general medicine. A few important questions from the patient management or the introductory part of general medicine, right? Yeah. So the 12th one, empathic understanding reflects which of the following characteristics? Accurately reflects others' feelings. It connects the feelings to concrete circumstances that are likely to be causing the feelings. It accepts the feelings as real and important. It is non-judgmental. It does not compromise the listener's objectivity. So you say like sympathy and empathy. Sympathy is like you have that sympathy towards others, but empathy is like understanding their real situation by assuming that you are in their scenario or situation, isn't it? So empathic understanding reflects which of the following characteristics? So let me just look at the dictionary for the meaning of the word empathy. So empathy is the ability to understand and share the feelings of another. Okay, let me just add up another option now. So we have option all of the above. Now give me the answer. I had done this intentionally. I just wanted to hide the last option. Okay, we have answers from Ramesh, Neha, Pritika, Sahiti. Neha Taufin. Hi Neha. So seeing you after a long time, maybe after a few months after starting our live session format. So is it Neha or is it someone else? Yes, Rohit, Megha, Gaurav, Lakshman, Farheen. Hi Neha. Okay, it's Neha. Okay, fine. Great. How are you doing? So I think you were busy the entire last week with Teachers' Day celebrations, right? By the way, I just wanted to express that personally, but let me just take this opportunity to tell you that you have done extremely well along with your co-anchor Jagadish. It was good. Fantastic. Keep it up, Neha. Okay, now give me the answer. So you say E now, right? I think most of you are angry with me because I'm hiding the options. I just wanted to see like how the variation is going to be. So you have B, A, C. We have almost all the options covered, right? So before I gave the option E. Yeah, you're welcome, Neha. Right. So empathy is connecting the feelings to concrete circumstances that are likely to cause the feelings. It accurately reflects others' feelings. It accepts the feelings as real and important, and also it's non-judgmental, right? It does not compromise the listener's objectivity. So all of the above, all the options are right. So empathic understanding reflects all the following characteristics, right? I hope it's clear. We'll just move on to the next one. Scholar X. Yeah, sure, Scholar. YouTube videos, yeah, they are for free for everyone. Of course you can. And please share the app so that I can download and also I can try that. And all the best for you. Okay. Yes, Scholar X. And also please do share the app with me or the details. I too will have a look. Okay, we have the 13th question. A 20-year-old woman has significant plaque buildup. Upon inquiry, she tells you that she brushes twice daily and flosses daily. So you determine that the patient should be educated about optimal brushing procedures. So which strategy might you first use in a series of steps for improving your patient's brushing skills? So I'll give you the options. I mean, among all these options, irrespective of the answer, option C seems to be crazy and it's like my favorite. Hi Sairaj. Sairaj, you say, I'll not believe you. Tell her you don't believe she pressure test. What Sairaj? Why? See, trust is very important. That's the previous question which we had discussed. So you should have that empathy for your patient. You just can't criticize and pinpoint at your patient saying, I'll not believe in what you're saying, what you're talking is all nonsense. You just can't say that, Sairaj. Maybe you are in preclinical, you feel that way because you're dealing with phantom head but not with the live patient. I do understand your feelings, but once you come to third year, I will take care of you. I'm just kidding, okay? So is it option A or option D? Right. By the way, Sairaj is one of my favorite students. So right now he is in second BDS. He is in second year and will be in touch through preclinicals. See Neha, Neha, you will not have this first and second, right? When you're giving 4 options, you should choose one. Richa, there is no option E for this question. See, of course, you can't have all the above, right? So, see, obviously, you can't have option C. You can't say, I'll not believe you that you brush twice daily. That will be hurting. Okay, Scholar, I'll just go through that. scholarx.org. Sure. And all the best for your project. Exactly, M. Neha. Exactly. So, Sairaj, you change your answer now. Okay, right. See, in order to initiate some kind of behavioral change in your patient, first you should understand your patient, right? So, to understand your patient, you should ask your patient to demonstrate their brushing technique. So, first you will advise the patient, ask the patient to demonstrate like how they brush, and then we'll try to modify it accordingly if at all any modifications are needed, isn't it? We just can't say I'll not believe you, or we just can't say you have to modify. No, understand the behavioral pattern and then try to modify that behavior, and that should be the strategy which has to be implemented. So it's option D. Ask the patient to demonstrate her teeth brushing. Sorry, what is it? Having some comments? Yeah, you're welcome, Scholar. Princess, we will ask her what does she use for brushing her teeth? Okay. Okay, Regina. Right, so we'll move on to the next one, right? So we still have a couple of questions. So we'll move on to the next one. Just give me 1 second. So Sairaj, what you said is still ringing in my brain. We'll discuss that Monday. Okay, now let's see how you're going to answer this. This is also kind of a general question. I mean, in the patient's perspective. So 14th question. What behavior can you typically expect from an anxious patient in the waiting room? So we have options. So we have option E also for this question, and I'm giving you the option E. Just try answering this. I think my MacBook is stuck. Okay, right. So is it higher judge? Okay, right. So Aishwarya, you said D, it's definitely me. Sanchita, you too said D. So what behavior can you typically expect from an anxious patient in a waiting room? He or she is more likely to sit still with hands clasped together. He or she is more likely to sit casually, legs crossed, reading a magazine. Sairaj, it's you. Option C, he or she is more likely to keep to himself or herself and not to speak unless spoken to. D, he or she is more likely to fidget in the chair, moving his or her hands and feet. And option E, A and C. So fidget is nothing but making minor movements. One second. So actually look for the meaning of fidget. It says like minor movements. I'm just searching for it. So fidget is making small movements, especially of the hands and feet through nervousness or impatience. So something like this. Okay? Right. So option D, you say option D is appropriate answer. So anxious patients are typically more likely to fidget in their chairs, unable to focus on the task at hand, such as reading or relaxing in the waiting room. Right? Option D is the appropriate answer. I mean, option C, it's like they're not speaking to anyone. It's maybe out of fear. So option D is the appropriate answer, right? So anxious patients are typically more likely to fidget in their chairs, unable to focus on a task such as reading or relaxing in the waiting room. Option D is the right answer. A, B, C, D. D. It's not E, it's D. Okay? Sairaj, whose knuckles do you want to break now? Okay, good. So I'm just typing out the answer. If in case you heard me wrong, it's option D. Yes, Tanmay? You can of course feel happy for giving the right answer. So we'll move on to the penultimate question for today. So it's been a long session. Yeah. It's been 1 hour. Okay. So what route of transmission? So it's regarding infection control. 15th one for today. So we have option A, option B, option C and option D. Here you go. So what route of transmission is a needle stick injury of infectious disease? Direct contact, indirect contact, accidental contact, parenteral contact. Parenteral, apart from the enteric system. For example, IM and IV, which we discussed yesterday. Accidental contact. What if I intentionally prick someone with a needle? Then it's by intention, right? The question is needle stick injury. It can be either through accident or it can be even intentional. People like me can do it intentionally, isn't it? I can go and prick Sairaj, for example, this Monday for giving me a crazy answer. But most frequently we see accidental contact. That's true, I do agree. But there can be a chance for even intentional kind of injury also, right? Now, what's the answer? So, what route of transmission is a needle stick injury of infectious disease? Direct contact, indirect contact, accidental contact, or parenteral? Parenteral? No, parenteral contact. We used to previously pronounce it as parental and parental, but our pharmacology lecturer clearly told us, because we never understood the meaning of parenteral, for example. We just blindly followed it, but later he came to us with a proper logical explanation saying that away or apart from the enteric system. So it's parenteral. Sairaj, come on. Good. Yes, Sanchita. Yes, Richa, Gaurav, Deepesh, Sheena, Tanmay, Aishwarya, Amol. Hi, Amol. Prithvi, Srish, Neha. Okay, Rohit. Neetu, Princess Jinka, Regina, Neha, Aishwarya. You're laughing. Okay, Lakshman, Jaj, Mega, Sahiti. Amol, you changed the answer again. Okay? Okay, good. Right. Direct contact, it's like even see, I have some cut injury or I'm touching it directly, the infectious part, it can be direct contact, right? So it's option D, parenteral. So parenteral contact is defined as transmission of pathogenic microorganisms by piercing the skin or mucous membrane, something which involves piercing. So example, intravenous, subcutaneous, intramuscular route by accident or by intention. Right? It can be either by accident or by intentional. Okay? Yes. Yes, Sairaj. Right. I hope it's clear. So it's option D, parenteral contact. So direct contact is not only with the needle stick, it can be even with a normal, if you contact with your broken, if there is any cut with your skin or direct physical contact or through any other means, blunt means, it comes under direct contact, right? So when you directly expose it to a pathogen. Indirect, for example, cross-contamination. I handle a patient, my gloves are contaminated, I handle this pen with that contaminated gloves, and you handle that instrument, so that could be considered as indirect contact, isn't it? Right, so it is option D, parenteral contact. Tanmay, see, it's not about ethics or emotion here, right? So no one would do it intentionally, but there can be some psychic people who can do it intentionally, right? Yes, of course we have the best example of, Sairaj has given us an example. What if I use a contaminated needle to draw blood from one of you, even without my knowledge? It can happen, right? So theoretically it can happen. So option D would be the appropriate answer. So please don't stick on to your emotions when you're answering questions, right? Go as per what's given in literature or theory. Okay? Yeah, Priya has some answer. Yes, Priya. What is it? Hi, Kavya. Yes, Priya. That's what we are discussing. It's only parenteral. Yeah, it includes subcutaneous, IM or IV. So you mean to say drawing of blood and administering drugs? Administering comes under parenteral. So drawing of blood, doesn't it come under parenteral? So drawing is nothing but you're trying to extract, right? So these routes are like when you're discussing the delivery, right? So yeah, I do agree with you. Okay. So you're supporting my answer, right? Fine, great. Just do let us know if at all we are deviating from the topic, right? So by the way, I want you to introduce yourself, because most of our aspirants who are attending this live session may not be familiar with what you're doing. So you are doing post graduation in which specialty, Priya? Just please introduce yourself. In the meantime, I'll just type the question. The last question for today. So one final question for today related to oral findings. So the most common site for oral cancer in the oral cavity, the most common site for oral cancer in oral cavity is lip, soft palate, hard palate, tongue and tonsils. Okay, Priya, you completed your MBBS and you're doing MD medicine. Okay, and you're from Telangana. Okay, so friends, she is Dr. Priya from Telangana, who is doing her post-graduation in MD medicine. And thank you so much, Priya, for joining us live and for also guiding me as well as my students. Right, so the most common site for oral cancers in oral cavity is lip, soft palate, hard palate, tongue and tonsils. So they do lot many studies, and based on the prevalence or incidence of cancers in different parts of oral cavity, they do come to some conclusions and they present that in literature. So based on that, we have this question: the most common site for oral cancers in oral cavity is lip, soft palate, hard palate, tongue, and tonsils. So the tongue is the most common site for cancers, for incidence of cancers in case of oral cavity. So option D is the appropriate answer, right? So it's been great doing this live session in spite of having a lot many issues, and I should say that I'm really lucky to have no network issues so far. And anyways, so thank you all for your patience and for your support. And this is for the first time we have done 2 consecutive live sessions with 15 to 20 minutes gap, and your active participation has made this practically feasible and possible, right? So thank you so much for your support. So hope you're all preparing well. So we are approaching another weekend. Today is Thursday, right? So we have another 2 more days for Sunday. So I hope you are making maximum use of your time. So don't assume that you have very limited time. We still have adequate time left. So every day, every hour, every minute matters. It's not just for this task. It's like any task in life. If you are serious enough in your preparation, if you are sincere enough, and if you want to prove yourself, consider every minute as crucial. It's not that only for PG you have to work hard and for the rest of the things it's like you can relax. No, never. So you have some task at hand before you, and you have some target and goal, and if you wish to achieve it and come out with flying colors, so every hour, every minute is valuable. So it's like we used to have this kind of orientation. It's like when someone, for example, just give me 1 second, my charging is dying, my phone is about to die. Yeah, thank God, right? So it's like we used to have this kind of orientation where when we were preparing personally, so I mean our guides used to tell us one thing. So no matter which class you attend, no matter which point you're reading, or no matter which notes you're going through, there is always an opportunity for you to learn at least 1 point. So this is a kind of positivity and hope which we should all inculcate, so that we'll have that kind of positive energy throughout the preparation. So no matter what you're studying, no matter what you're listening, pertinent to the task which is in front of you. So for example, your task now is to crack entrance. You have to listen you do listen theory classes, you do listen live sessions, or you do attend some WhatsApp discussions, or you write down a test, or you watch a recorded video. No matter what you do, so it's like whatever you do pertinent to the task at hand, you always have an opportunity to learn at least 1 point, 1 relevant point from that particular activity which you have been doing. So have this kind of right attitude, you will feel good, and it's like you will have this constant desire to learn without feeling depressed or demotivated at any point of time, right? So have this kind of orientation and be positive and hope for the best, and make sure that you utilize each and every minute for the task at hand. Of course, it doesn't mean that you have to work incessantly without any break. We all do need break. So yesterday it was like hell for me. I had some issues, I couldn't sleep properly. So without break, if you think you can do something, if you think you can save time, it's not a wise decision. So you want to invest good amount of quality time in your preparation. So make sure that you have adequate sleep. That's very, very important. Sleep and food are 2 factors, environmental factors, which are going to influence your preparation positively. Quality sleep and quality food. right? So say no to coffee, tea or something. Have green tea, have healthy fruits. So even though it doesn't really satisfy your taste buds, but it will have a lot of positive impact on the way in which you think, the way in which you feel, and how your body works, which ultimately affects your preparation, isn't it? So you might be wondering why I'm talking all this, because these are some of the important factors. If you think that learning subject is one side of the coin, the other aspects like how you orient yourself, the motivation you have, the kind of attitude you inculcate, it's like the other side of coin, right? So you can't neglect both. I mean, you can't just neglect one side of a coin. Coin is a coin with two sides which are equally important, isn't it? So have this perspective in mind and proceed accordingly. Don't get demotivated. There is no point in getting demotivated at any point of time. It's like a level playing field. Everyone has an equal opportunity to score. The smarter you work, the harder you work, the more sincere you are, the more chance that you're going to crack entrance, right? So just take it as a positive pressure rather than getting upset or depressed, assuming that everyone is giving you a severe competition, right? So it depends on how you take it, right? So you have this beautiful, inspiring Swami Vivekananda's quotes. Just go through them. We have discussed them in the previous Saturday's live session. So stick them on your walls. That itself should motivate you enormously, right? So I'll just stop here. I started having this habit of talking incessantly. I don't know how the recipients feel. Anyways, I hope you got some valid points, subject as well as general discussion, and go through the previous videos as well. And I personally feel the videos which we make are like high yield synopsis. You'll get lot many points in a short duration of time in a simplified manner possible, and your feedback is always welcome, right? So I wish you all the best. If you have any questions, you can drop them now. Exactly. And how tongue, sir? Deepesh, welcome. Kavya, you asked me a question and you yourself gave me an answer. You said more blood supply, more chance of metastasis, or more chance of incidence of caries. It's as per the literature. As I said, based on the incidence of the cancerous lesions. Okay, Regina, you say first 5 questions. Okay, I think someone can help you. Prithvi, or any one of you. Please do take screenshots of the first 5 questions. Yeah, Hambrish. Hi, Hambrish. Crazy boys. Priya, you say it's tongue because most of the tobacco users keep the tobacco at the lateral aspect of tongue and cheek. Okay. Yeah. Thank you, Priya, again. So tobacco induced. Okay, that seems to be logical. Even in tongue, we have one question also. Priya, just correct me if I'm wrong. So in case of tongue, most of the cancers are seen on the lateral aspect, right? So posterior border, the lateral aspect of the tongue, as I have referred in one of the books called Schaefer's. We have this oral path. So in tongue, the area which is more prone for greater incidence of care, I'm getting caries, right? It's cancer. Cancer is the lateral aspect, the posterior border, the posterior part of tongue, isn't it? Yes, Tanmay. Hamrish, you're very welcome. Prithvi, tomorrow it's morning or evening? When shall we have? Can you all get up at morning? I'm ready. I can do it at 5 as usual. So do let me know if it is convenient for you, because it's like an interactive, it's going to be an interactive session. It's not like image-based discussion. Also, I'll be projecting you some radiographs, and I need to have some answers from you, right? So you all decide now. and let me know, and based on that I'll post the update in the group, whether it's morning or evening. So anything is fine for me. Morning 5 or evening 7:30. Gaurav, you're most welcome. Revision tests, okay. I'll let you know through mail, Neha. So we have actually divided them. I haven't shared that with you yet. So yeah, we'll definitely let you know. We divided all the subjects into 3 revision tests. We'll drop a mail before the weekend, okay? Yes, Neetu, lovely to have you. Thanks, sir. And lovely to have all of you as well. You're most welcome. Yes, Neha M. We have a fixed timing. We have a schedule. You can drop a mail at proudtobedentist@gmail.com. We'll send you the schedule, or you can just join our WhatsApp update group. I'll send you the link in mail itself, right? You can just drop a mail. Yes, sir, Josh. We don't have buccal mucosa in the options, right? Yeah. Aishwarya, yeah, you're welcome, Aishwarya. Great to hear that. Rohit, okay, you're asking for comparison. Yeah. Thanks, Priya. Rasul, okay. Morning. Yeah, yes, Priya, it's posterolateral aspect, right? Yeah, thank you. You want morning or evening? Deepesh, evening. Kavya Sadhu, Mari 5 AM. Mari eppudu kavali Kavya neeku? So you're a Telugite, Kavya? From which state are you from? Kavya, why you don't want in the morning? We usually have morning sessions. So we actually planned a morning session today also, but last night it was like crazy, so we had to postpone it for this evening. Mari eppudu kavali neeku cheppu, Kavya? Yes, Prithvi, it's been a long time. We had morning session, evening. Kavya, you want? Kavya, you podun legustamu 10 nuvu. Okay, you get up at 10 o'clock in the morning, Kavya. Sorry, 10 o'clock I'll be there in college. Sairaj will not accept, even though if I accept, Sairaj is not going to accept because I have to teach them, right? So if I'm live at 10 AM, then who is going to take care of Sairaj? Sairaj, how to manage our schedule, right? We have to prioritize, right? I have this habit of writing down. I just note down my schedule once in a while, at least once a week, divide it accordingly, and then manage it accordingly, right? So it's a very huge thing to discuss. We'll definitely have a separate session for that. So at least make sure that you have this habit of planning on weekly basis initially. So daily planning, it's quite difficult to follow, but at least Saturday or Sunday, have this in your mind, like for the next week, what are your duties, or what are the things you need to get that done, and just make a note of them on a piece of paper physically. That's very important, and based on that you can tentatively divide them, like Monday you want to complete this work, Tuesday. So that's how I manage. So I write down a schedule and I share the same with all of you also, and also in social media. And I stick on to that schedule and try to follow that schedule as much as possible, even though it's not practically feasible all the time, right? So there can be break. So you need to accept that. We can't perfectly follow any schedule, but you should have an overview, a kind of schedule, so that it acts as a guiding path for you, right? So make a note of schedule, of weekly schedule, preferably daily schedule. If you think you can follow that confidently, then you can go ahead with daily schedule also. Like 9 to 4 you'll be there in college, you need not worry about that. So morning 5 to 8 AM you can divide accordingly, 5 to 6 or 6 to 7 or 7 to 8, or evening from 5 to 10 PM. So you can divide time accordingly. Practice that for at least 1 week or 10 days, get used to it, and then you can start following the same for months or years together. And if at all any modifications are needed, you have to modify them here and there, right? So you have to modify your schedule time and again, and you have to update your schedule constantly so that you'll improvise yourself. You'll improvise your performance compared to your own performance last week, right? So that's how I personally follow. Neha, you just go through your PDF. I think I sent you PDF long back. You have a break test, right? So we had cumulative test 5, we have break this Sunday. So we will not have any test. The next Sunday, we're going to have a revision test. Rohit, I'm sorry I missed your question, I think. You're talking about buccal mucosa. The buccal mucosa also, but you're talking about buccal mucosa? I didn't get you. Okay, Kavya, you are from Telangana, Hyderabad. Okay, fine. So glad to hear that, Kavya. So we have a few Teluguites today. So Kavya, and we also have Priya. Okay. Prithvi, when you teach in the morning, whole day it goes good. Okay. Okay, Kavya says 6 to 9 is revision time for you. Still your wish. Oh, you're talking about buccal mucosa more or less than tongue. I think it has to be less than tongue based on the explanation I had. So tongue is the most common site for cancers, carcinomas. Yeah, yes Priya, thank you. So it's less than tongue. Hi Nikhil, hello. I think this is the first time you're joining us live. We're about to wind up the session. Right. So we shall have a live session tomorrow evening then, based on the majority. So we shall have this image-based discussion tomorrow evening, 7:30. Is it fine? Okay. Yeah. And sorry Prithvi, we have to go by the majority, right? Anyways, we'll definitely have live sessions at least from next week, because this week it has been a kind of disturbance because of network issues, or else I wouldn't have deviated from my original schedule, which I had promised to all of you. So at least from next week, I'll try to stick on to the schedule, and also we'll have live sessions, right? In the morning, early in the morning. No, it's only temporary, right? 5 a.m. it's because of the issues, right? So as it is getting late again, it's becoming hectic. Again, I can't expect the same kind of response early in the morning. I can understand. So that's the reason why I'm giving you an option this week. So next week we'll try to have the same morning sessions as usual. We'll stick on to the schedule as much as possible, right? Okay, so tomorrow evening 7:30 p.m. approximately, we'll see you with a virtual classroom session. I'll project you images on my LCD or LED screen. We'll have some brief discussion, right? Okay, so it was a great day for me, and it was a great session. It was great time interacting with all of you live. Okay, so and I really hope you got some valid points from this discussion, and I wish you all the best. And see you again tomorrow at 7:30 p.m. Yeah, early in the morning we usually don't have any internet issues, right? Okay, fine. Right. By then, see you again tomorrow evening at 7:30 p.m. Yeah, thank you, Rohit. Thank you for the feedback. Yes, Prithvi. Yeah. Okay, Priya, thank you so much. if possible, do try joining us, Priya, because radiology again, your guidance will be of immense help for us. Yeah. Bye. Bye, Kavya, Regina, Neetu, Hambrish. Bye. Bye, Ajaj. Take care. Good night. Yeah, Ramesh, Sahiti. Good night. Good night. Yes, M. Neha. Yes, Aishwarya. Yes, Dipesh. Okay, okay. Yeah, I can understand. I can understand, Priya. Anyways, thank you so much. Okay, bye. Good night. Take care.